Okay, so I'm going to read one assignment from school. If you're here, thanks. If not, cool. Anyway, so this one is like, I was going to read it from school. We'll see if I release this. Your friend TW is a 24-year-old single man with social anxiety and no other significant medical problem. He currently sees a therapist weekly, and this has helped his anxiety conserve, has helped his anxiety. But he still experiences anxiety in social situations. He he does want he doesn't want to take prescription medication and prefers a natural approach to self-care. He lives alone most of the time and sometimes stays at his parents' house. He wants to go out and do things with other people, but is too anxious, so he declines all invitation and only goes to work if he leaves the house at all. And only goes to work if he leaves the house at all. This makes him sad. He wants to be active and wants to go out on lunch dates with his sister. He wants to form friendships at work by socializing without always worrying about potentially embarrassing himself in public. He wants to know if cannabis is an option to treat his anxiety. He knows you're in a medical cannabis graduate program, so he asks you if you know about this topic. Now this is things from school when I was doing the medical cannabis. They'll give us fixed scenarios and then we had to like do our prognosis and stuff like that. So this is saying, based on the research you reviewed about cannabis and social anxiety disorder, explain the results of the randomized controlled trial you appraised in assignment 3.2, yada 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 yada, to treat cannabinoids in treating social anxiety in 5 to 10 sentences. When educating this patient, consider what evidence shows and what evidence does not show. Consider the quality and quantity of available evidence. Overall, how robust is the evidence for cannabinoids in managing social anxiety? So, cannabis and social anxiety. The overall results from the randomized controlled trial showed significantly no difference between the healthy control groups and patients who use CBD for their social anxiety disorder. I would not use this experiment as it is from a small study group, and I believe there is potential for observational bias. This was also a single dose study that did not give any follow-up data or adverse events. I believe cannabis may help with social anxiety disorder along with a healthy lifestyle such as eating healthy, getting enough sleep, exercise, etc. There is also limited evidence that cannabinoids provide anxiety There's also limited evidence that cannabinoids improve anxiety symptoms, but there is evidence that daily cannabis use is associated with increased anxiety symptoms. More experimental studies are needed, but the right CBD dosage, method of delivery along with a healthy lifestyle and continued therapy, I believe this patient may see improvement with his fear of embarrassment due to his social anxiety disorder. So, cannabis and anxiety disorder. One, there's not a lot. They do say use cannabis for anxiety, but depending, especially in my opinion, and what I've heard people say, if you're doing like the things they sell in the dispensary from the state type of shit, it gives you more of a head. And if you're someone who likes to stay in your head, it gives you probably maybe a little bit more anxiety because you might be trapped even more in your head than living present and being present. Again, these are all my opinions. Let me just be honest here. Plus, this assignment was my opinion. So, for me, like just my thing of have I used cannabis for anxiety? Yes. I used it when I was working at the cannabis lab and we had to go to different networking events, and I would be the one to volunteer because I wanted to get myself out of that shell at a young age, be able to work a crowd for a networking event. And it was something where I'm like, in my head, I was like, it's better to do it in a place that's like smaller and developing, because cannabis is still a development in science. It's better to do it in a smaller setting where things are developing than going to like a big conference and like not really know how to work a room. So that is something where it took me some time. At first, I would smoke a little bit, go there, and then this one person, I think my second time doing it, I knew how to talk to people, I know how to listen, but I didn't really know how to talk about myself. And then after I was done talking, she was like, okay, well, and about you. And she's like, talk. And that's when I learned and I had to get out of my shell. Like, okay, this is just like a regular, show your face, talk a little, like a party, mingle, show your face type of thing. But it wasn't cannabis that helped that. That was me getting out of my head and being, okay, be present here, be vocal, be noticed. Be noticed at the end of the day. Don't be a fool, but be noticed. Get out of that shell, be social. And it's not cannabis. It's just me getting out of that. So some people may need something because alcohol, caffeine, it helps relax you a little bit versus being in your true authentic self. And a lot of people, it's hard, especially, and I'll just say it's hard. Being your true authentic self is hard. So is there evidence for that? No. For the most part, most times we're like, it gives you even more anxiety. It's something as an oral fixation. So if you're more of a smoker and you're constantly doing that, okay, I don't judge anyone or their drug of choice. Caffeine, sugar, weed, cocaine, like your drug of choice. But you just need to self-help, sleep, food, air, exercise, things like that, self-care. Things like that is all overall mental health, where they don't want to tell us, they don't want to take care of us.